Oh, this morning we sadly report how the Department of Veterans Affairs has once again failed the men and women it's supposed to serve. Take a look at these disturbing numbers from a new government report. 284 sexual assaults reported in the VA system over a 3-year period. And even more shocking, many of those cases not reported to the VA leaders who could have done something about it. The cases include rape, inappropriate touching, and forceful medical exams. And it wasn't just patients. Employees were among the victims as well as the attackers. Both men and women were attacked. And once again, I want to remind you, this is the same VA that put thousands of veterans at risk over the last couple of years because of dirty surgical instruments. Congressman Jeff Miller is on the House Veterans Affairs Committee, obviously reacting to this story. You know, Congressman, we have talked about the medical mistakes for years, particularly on this news program, but you don't think malicious intent when it comes to those types of stories. Now you've got the lack of safeguards at the VA taking on a whole new meaning with sexual assaults. So, you know, were doctors sexually abusing veterans? Do we know exactly the details of who was doing what?
Well, the GAO report doesn't go into specifics as to who it was, but we do know that it was patient on patient, patient to employee, employee to patient. So it was the myriad of people within the system. The thing that concerns a lot of us greatly, besides the fact that the sexual assaults occurred, was that they did not report it to the upper level folks. So people like Secretary Shinseki is basically unaware of these issues because they're not being reported as required by regulation.
So let me ask you, those who knew about this and could have done something about it, how are you going to hold them accountable?
Well, one of the things that Congress does, and our committee in particular, with our Oversight and Investigation Committee, is to look exactly in depth as to what occurred. I mean, we have the GAO report that was actually requested by the House Veterans Affairs Committee that will be the starting point for us. So we have Anne Marie Burkle from New York, who is going to be the lead with the Health Subcommittee. We're having a hearing this afternoon, but I think we probably will bring the Oversight and Investigation Subcommittee in and actually have joint hearings with the two together.
Well, what's sad is we've heard the stories and we've talked about how sexual assaults have not been reported out in, you know, in country and within the military, and now we're hearing about it in the VA where, you know, vets are supposed to be getting treated and taken care of. So are you going to push a change in how these cases, sexual assault cases, are handled from the very beginning and reported to the higher-ups?
Oh, absolutely. I think it already is required that it be reported. For some reason, there's a culture within the system. I was in Miami last week and was discussing other issues, and you talked about some of the sterilization issues that have taken place with medical equipment. There's a culture within the system that people at the lower level are afraid to bring things to the top for fear of losing their jobs. And that's not an acceptable issue at all, especially when you've got criminal intent with sexual assaults like the GAO report has brought forward. And remember, there are hundreds of residential facilities out there, and right now they've only studied in depth about 5 of them.
So can we or will we see prosecution of these attackers?
Well, we want to know, in fact, what has happened with the people that have perpetrated these assaults, the rapes, as GAO has called some of them. What has happened with these employees? Are some of these people still within the system? I don't know. The only way to find out is to ask the question, and if they're still there, then not only do those people need to go and need to be processed, but certainly their supervisors need to go as well.
Final question, Congressman, before we let you go. How can vets be assured that they can still go to the VA for proper treatment and not fear being attacked?
Well, I can say that there is complete focus by the VA. I have talked with some of the undersecretaries. I want to talk with the secretary this week. It is not their grandfather's VA system. The health care that's provided, the mental health care that's being provided now by the VA is second to none. But when you have things like this that rock the very foundation of the VA, I can understand why some veterans would have questions whether they should go into the system or not.
We'll be looking to you to see the changes implemented, that's for sure. Congressman Jeff Miller will continue to follow the story. Appreciate your time today, sir.
Thank you.